We will carry out our first assessment in 2 days. If all goes well, we will permit your return to Ankara. As things progress, we will continue our monitoring. Turn back towards me again. We don't always encounter such asymmetry in patients, Bilal. We often see asymmetry, but the thing you have, it's an asymmetry that even Metin Şentürk would recognize, one that he would observe. Yes, indeed.
I have quite a bit of gynecomastia.
Tighten your chest. I mentioned that we have a risk of sagging, especially regarding your right side, if you remember. We do not neglect the tough stance. After the surgery, you are the toughest guy in the country. To make the skin stretch more, relax, let your hands rest by your sides. Keep your head held high. Hey friends, we have looked at the drawings and the examination of this patient. Now we will commence the surgery. We will carry out the procedure with the technologies we always use. So, there is a mix and gynecomastia issue, both adipose tissue and breast tissue. We will first remove the fat tissue with liposuction. Then, we will complete our surgery by removing the same cut breast glands. If all goes well, we should be able to let him go from the hospital in 3 to 4 hours. He won't need to stay overnight. We will continue to provide you with information in this way during the process.
So I think they don't need to be afraid, because when I came here, we go directly to the clinic first, not to the hospitals. So during that process, Ali Hoca explained everything about how it would happen, what kind of things would happen to us, and so on. You have no questions left in your mind regarding that. And you are entering the surgery in a relaxed manner. Furthermore, Ali Hoca once told me that you can lie down at any time you prefer and things like that.
We went there early, you see, to conquer our fear of the hospital and such. The nurses in the morning were all very attentive and concerned. When I came out, there was no pain at all.
After the effects of the anesthesia wore off a bit, I had a slight pain.
I had a bit of discomfort with arm movements, but now on my second or third day, I feel very comfortable. Ali Hoca said if it hurts a lot, you can take it every 2 hours, but I think I only took it once a day or not at all, so there was no issue in that regard.
2 to 3 hours after the surgery, we opened it and you saw.
Better than I expected. You'll see the waves, the indentations and protrusions. Don't let them scare you. They will all pass. Remember, I told you there is a risk of excess skin on the right side. After the surgery, we will look tough like this. Don't forget, I need to explain these things. After getting the dressing materials, I will teach you the physical culture exercises with this underpad, how to do them. We will take the resistance on the right. They worked a bit inside. Look, it looks nice. Good job. They did well. How was it?
The operation went really well. Ali Hoca explained everything before the surgery. Thanks to his help, I had no questions left in my mind. I'm satisfied in that regard. Now I'll see the result. I'm going to pluck a little of your hair. Don't take it personally, brother. I believe you'll be satisfied with it. Hopefully, it will be like that. It wasn't a difficult process at all. You can leave 2-3 hours after the surgery. After waking up from anesthesia, he explained math to us.
You're not familiar with the anesthesia process. Other than that, I feel fine.
He said not to let anyone speak ill of Ali Hoca.
You're not paying attention. Come on the video too. You can demonstrate it like this as well.
I believe everyone should come. It needs a safe place.
I'll take some gas from here now. Very nice. Bravo.
We didn't doubt you, teacher. Just hang in there, my brother.
Look, without realizing it, I placed the resistance there and took it as well. Quickly, without delay. No hematoma, thank goodness. Hold it this way again. Now look at yourself. This is just the start, as I said. If you like it now, it will be much prettier post-surgery. So, for example, please don't misunderstand this right glasses of yours. It had a very high risk of sagging like a woman's breast. Gathering that without taking off the leather is hard. Luckily, we came out well. It looks good.
That's really awesome, Professor. You mentioned that the coffee could potentially shrink. It has actually shrunk, which is a beneficial effect of the operation.
I'm not actually diminishing it. It happens on its own. I'm describing the positive aspect as an effect. Now, dear friends, we usually see asymmetry in every person. What do we mean by asymmetry? When we divide humanity in half, our right and left sides are inherently different from everyone else. It doesn't matter if it's a man or a woman. Some have this difference more clearly, while others have it less. But everyone has a symmetry. In our patient, it was much more evident. We will show you the right breast's pre-surgery images as well. It was almost excessively large. There is sagging and the milk gland is very big. The left breast was a bit smaller than the right one. You already know our surgical plan. I will access from these 2 points. I am removing both the fat tissue and the milk gland from this area without making an incision at the nipple. We performed 800 cc liposuction on the right side of our patient. On the left side we did 400 cc. However, the breast tissue removed from the right side was so large that I could say it was almost larger than a fist. The left side was smaller, but as you can see in the end, we will achieve a flat appearance on both sides. Since we just opened the dressing, you can see some slight waves. When our patient takes off her corset to bathe tonight or tomorrow, she will see these areas flat again.
I didn't expect it, but it turned out so well that I liked it. Mine was a bit more normal, one-sided and larger, so I was worried about sagging. There is a slight issue, you know, because you took a piece. There is a small lack, but I'm happy with it, because it needed to be taken. Right now I feel very comfortable. After removing the underpad, you feel much more comfortable anyway. Wearing a corset isn't particularly uncomfortable, you know. It has loosened and adjusted somewhat. It doesn't trouble me. I need to drive this car after all.
Next summer, for sure.
I loved it.
You loved swimming a lot.
It was really having a significant social impact. I believe they should be there.
Because otherwise it doesn't get better. I've done quite a bit of research. It doesn't go away with medicine or exercise. It needs to be addressed somehow. I think Ali Hoka is the one for this. I don't know anyone else, really.
Let me take a look. You've always looked. It's my turn now. Go ahead, or come sit down with your things. Continue to use the relevant cream a bit more again. You will have to stop doing that. There is no slouching like this. You will always stand straight. Then the result will be much better. He hasn't really begun to exercise. Then remove those books from the library. Also lift them at the same time.
My teacher is currently lifting it. We take these types of books off and put them on the shelf daily.
Reading is good. If you do a bit of exercise and develop your chest muscles a bit more, the result will be much better. Sports provide a better version of good. That's what I'm reflecting on, teacher. If you can make time, it would be really great if you could do it in the classes. So, my name would be a better doctor too. When you work out, the results will be lovely, and everyone will praise Dr. Ali for his excellent surgery. It will look even better. Let me check this out. Next, we will have a yearly visit from a brother. We will wrap up the doctor's checkup. I'll tell the kids to write your prescription now.